This is a 30-year-old guy with severe persistent pain and weakness of external rotation. MRI shows a cyst at the suprascapular notch, and the treatment is by arthroscopic decompression at the suprascapular notch. This animation is to demonstrate how we go medially along the supraspinatus muscle and reach the suprascapular notch and then release the transverse scapular ligament, thus decompressing the suprascapular nerve as shown here. The patient is placed in V-chair position. Two lateral portals are utilized for the procedure. Shaver and arthroscope are inserted through two lateral portals. Dissection is then carried out posterior to the coracoclavicular ligaments medially till transverse scapular ligament is isolated at the suprascapular notch. The transverse scapular ligament is visualized clearly and tissues are cleared medial and lateral to the ligament. Superior-medial portal is then made and a blunt probe is inserted. This probe helps to clear off tissues. A cyst is also noticed just medial to the ligament. This cyst is punctured and decompressed with the help of the blunt trocar. The gelatinous fluid from the cyst can then be visualized escaping from the cyst. The ligament is visualized again and tissues are separated medially and laterally at the notch. This ligament is then transected with the help of basket punch inserted from the superior-medial portal. Below the ligament, the nerve is visualized crossing the notch. So this is how suprascapular nerve is decompressed. Thank you. Email me at dip.it@me.com or shoulderclinic@gmail.com. Thank you.